Hi there, my name's Dave Willis and I'm here to talk to you about some strategies that people can use to help themselves or other people to quit smoking. We need to understand that smoking is a very challenging thing to give up and a negative behaviour, but with the idea of these strategies and supportive people around you, it is certainly possible to do. The first thing you would need is to establish, the readiness of the person to actually quit smoking. Many of the smokers feel like they want to give up because they feel pressure from other people, but when they try to quit themselves or even with the help of some other people or products, it doesn't always come through. How will we firstly initiate that is you would look up, there's several questionnaires or surveys that they can do online, which just gives the person a chance to feel, express themselves in how ready they really are to give up. The next stage would be maybe to do some what we call motivational interviewing. Now, with motivational interviewing, you're asking open-ended questions, trying to get or elicit responses that the person is really keen or wanting to give up that habit. We're promoting discussion. We're not looking for just yes and no questions, but you're really trying to give the person ownership of what they're trying to achieve, giving them the opportunity, come up with ideas, some strategies themselves, and all sorts of things like that will help them give up in the long run. The next strategy we could use is what we call a functional assessment. So what we're trying to do in this part is identify the antecedents or those little factors that influence a person's smoking, whether they be a certain event, a situation, or some sort of stimulus that encourages the person or seems to promote the response of smoking to those stimulus. What the focus then would be on attacking those antecedents and trying to take them out of the equation to make it easier for the person to give up their smoking. Probably the two most common ones for smokers is drinking and socialising. Obviously drinking alcohol, going to places where other people are smoking, are very difficult situations to avoid, but in the long term it may be the best interest of the person to try and avoid those situations where possible. Further strategies that we're going to use would then be to establish a baseline of the behaviour. It's very difficult to work out how to stop a behaviour if we don't know where they're at in the beginning. So what you would encourage the person to do is just record for a week their daily smoking usage. That would mean how many cigarettes they smoke each day. You could then work out an average if you wanted to, and then be able to set a target after that. Setting goals is important, and with that in mind, you would set a target date for when you want to totally quit smoking. But in the meantime, we would use a thing called differential reinforcement for a lower rates of behaviour. Now, we'll talk a bit more about reinforcement shortly, but the differential reinforcement basically looks at targeting a reduction week by week rather than a completely giving up, once and for all, and then trying to maintain that. What we do with our the assessment, we are now continuing to get the person to keep record of their cigarette smoking through the week, and then you may take 6 weeks, 7 weeks, months even, depending on how many they're smoking to start with. So it's good to set those targets that you might want to reduce from 10 per week down to 10 per day, down to 8 per day, 7 per day, and so forth, so that eventually you get a realistic target of when you should be able to quit smoking altogether. One of the other things with the differential reinforcement is the use of a chart. And the reinforcement part comes from viewing the success that they're having over time. If you are able to draw a graph, and plot how many cigarettes they're having, the visual representation of the reduction shows the progress, and hopefully that will positively reinforce and motivate them to continue to follow those strategies and to keep working towards that goal of 0 cigarettes. Once we start with the intervention phase, this is after we've established our baselines. There's definitely certain things that we can try and do that will help the smoker to give up. Firstly and foremostly is social reinforcement, and that means that get people on board. Many people are embarrassed by the fact that they do smoke. Some are embarrassed by the fact they're trying to give up smoking. What they can do is, by encouraging the people around them to be supportive, let those people know, whether it be in the workplace, whether it be their family, whether it be their friends at their sport, the pub, wherever. That's much better getting that way. If you can get them to then reinforce those behaviours, little comments like, hey, you're doing a great job, nice to see you're not smoking, hey, it's fantastic that you're not smoking while you're out drinking. Those sort of comments can really be a positive reinforcer and a very strong influence to help people give up smoking. Another strategy that could be used is the mindfulness. This uses relaxation techniques. Now, the main effect of smoking is the cravings that people get, and this is what causes most of the issues as far as maybe anger and stress and how they deal with it. And they find that the cigarette reduces that. Taking on mindfulness, relaxation, being together, just calming down and trying to work your way through those cravings that will only last, 5 to 10 minutes. If you can get through that period, then you've got a much more chance of, putting off the smoking cigarettes in total. Alternatives to smoking are always a good idea. If you feel the craving coming along, try to take your mind off it by doing something else. Being physically active, simply going for a walk, do 10 push-ups, 20 sit-ups, 5 minutes of exercise, play a game on your phone. You could use some phone apps such as podcasts, listening to those. You could read, any sort of things that can take your mind off it and hopefully relax you again, just till those cravings can disappear. Another strategy that's very popular and has proven to be quite successful is the use of nicotine replacement therapy. Now, these are known as NRT for short, and they come in gum, lozenges, patches, and so forth. Now, the criticism has been from people maybe not fully understanding is that, you are still feeding the nicotine addiction. And that's true. But what we've got to understand is that the smoking is what causes most of the illness and disease that we suffer through the cigarette smoking. It's the cigarette smoke itself, the tar, all of the other chemicals that are in the cigarettes. They're the things that really cause the problems. Nicotine just keeps the addiction and keeps that flow of wanting cigarettes going. So, sure, I understand that some people might not see nicotine patches or gum as a solution, but it's certainly better than just having the cigarettes themselves. Finally, one thing we really want to do is going back to that reinforcement, going and finding those positives out of it. Things like feeling better within yourself. You've got a bit more energy. You can breathe easier. You're not coughing as much. Your sense of smell, your sense of taste returns. Your fitness levels improve. All these sort of things should be reinforced by people around you, but also within yourself. If you're the person who's trying to give up smoking, look for the positives. See yourself as doing a good job, and hopefully within a few months, maybe weeks, you'll find that smoking habit is something in the past. Thanks very much.